So what is ADHD and what is it not? ADHD is something that you're born with. It doesn't have an onset unless the onset is in the womb. Um, Typically, it's a combination of something that happens in the womb or just genetics or a combination of the two. Several areas of the brain have to be affected in order for someone to exhibit enough symptoms to meet criteria for ADHD. So if something happens in in someone's life and then there's symptoms afterwards, it may be better attributed to whatever that thing was. So if someone has a head injury or concussion and then there's symptoms that look like ADHD, it might be more from a TBI. So with an ADHD diagnosis, therapists will try to rule out anything else that could be contributing to those symptoms. So that could be head injury, that could be sleep problems, PTSD, dissociation. Um, there's a lot of things that we look at because distractibility, although we can experience that from depression or anxiety, it's different with ADHD. It presents in a different way. It's not just not being in the moment. There's a lot more to it than that. So, um, if you are concerned, there are resources like ADHD Online, therapists on like Psychology Today. You'll want to find someone that's willing to go through and take time to rule stuff out because symptoms don't necessarily mean a diagnosis. For example, with ADHD, there's 80% more dopamine receptors, so task initiation is very difficult because there's less dopamine to begin with. And then once you get started, all the dopamine is vacuumed up and it's really hard to keep going. And you're like, oh, this is so painful. I'd rather be doing anything other than the thing I'm supposed to. I'll even clean my room instead of work on my final. And then it gets to the point, oftentimes, with task management, procrastination, that at the very last moment, there's this surge of adrenaline. Oh, suck, I've got this deadline. I gotta get this done right now. And that serves as kind of a stimulant. And that stimulant kind of helps. It's kind of like Adderall or methylphenidate. Maybe not quite like that, but oftentimes that is the common experience, is to procrastinate and then to use that sort of adrenaline rush to then be able to function well. So these are ways that ADHD might be different. There's also issues with time management. There's issues with working memory. Sure, there can be working memory issues from like a head injury. But yeah, how these things influence someone, like task switching. Task switching for ADHD can be very, very, very hard. Now, that may not necessarily be the case with someone that just has distraction. Yeah, task initiation, staying on task, task switching, having things steal your attention, not having a background, and just everything is foreground all right here at one time. So it's like you're hearing the sound of my voice, what's in the background, all the different sounds in the background, even what's in the background of this, if there's like a humming in the background, all of that happening all at once, almost at the same intensity, and you're trying really hard just to focus to this one thing. That's one aspect of many of what ADHD might feel like. I hope this has been helpful. I didn't go through the criteria today. I will soon. But if you or someone you know has the symptoms, just know that symptoms don't necessarily mean that you have that diagnosis. So I might get in trouble here with some community members by saying this, because a lot of people think self-diagnosis is valid, and I see that there's absolutely positive things to that. But I also see there's negative things to that because of all the extensive things that need to be ruled out first. So also having a diagnosis with ADHD allows you to get treatment that you otherwise wouldn't get. So just diagnosing yourself and not having a professional diagnosis means you don't have access to certain treatment, like medication, which is one of the best treatments. So if I ticked you off, please leave a comment and tell me how I'm such a bad therapist for saying that self-diagnosis is not valid. I will pin it and we'll have a good discussion about it.